Hey everyone, Christina Jenkins, owner of Bare Necessities here. Today I am with Jess, our head esthetician, and Tracy, our spa director. She is gracious enough to let us use her face for the demo today. We are going to be doing a live microchanneling demonstration. So Jess has already predetermined the cleansers for Tracy's skin. She did that by doing a skincare consultation, which we provide for all of our clients to ensure you're getting the best treatment possible. So if you're ever in doubt, or if you're ever wondering what treatment is best for you, we do have skincare consultations. So you can call anytime and book that with our friendly client coordinator. So thank you so much for joining us today. This is our very first live demo, so we're shaking the nerves off and getting used to being live, which we will do once a month on Wednesdays for the rest of the year. I know, can't believe that there's only 3 months left in the year. Pretty crazy. But so right now, Jess is cleansing Tracy's skin. Typically, you want to come to this service without any makeup on, but if you're in a rush, coming from work or dropping the kids off, no worries. We will definitely take your makeup off and get you all nice and clean for the service. So who is microchanneling good for? Really and truly, microchanneling is great for all skin types. That's why we love this service, because there's really not a whole lot of crazy contraindications. Really the biggest one I would say, of course, if you're pregnant, if you have diabetes, yes. Or any skincare conditions, rashes, anything like that, or if you have extra sensitive skin, definitely let us know, because we wouldn't want to further inflame or cause any more damage to your skin. And then of course for our Botox ladies, or toxin, whatever, however you say it. If you've had that within the last week, or fillers, you don't want to get this service. You would want to do this and then get the service. Right. So microchanneling is definitely going to be a safer alternative to Botox. However, if you get Botox, it would be an enhancement to Botox.
Works great together.
Yes. So, all right, she is done cleansing Tracy's skin, and then the gun is actually already pre-sanitized, and then she is going to be putting some gloves on, and then she's going to be doing the delivery serum, which is going to enhance the microchanneling treatment. Right. So Jess, what would you say the pain level is for this treatment?
Yeah, so I think the smaller depths that we're going to do on Tracy today, she doesn't need to be numbed for. It's a little bit prickly, but nothing too bad. It's definitely manageable. So yeah, so anything at the 0.25 level, definitely manageable. And anything higher than that, we can definitely numb you with our lidocaine.
Yes, we do provide lidocaine. It is a $35 add-on, because you do have to let it sit for about 15 to 20 minutes to really ensure that we are numbing the skin properly.
Right, so if you're nervous about it, we can numb you either way, even at the 0.25
yeah.
if it scares you. So this is the gun, and this is the tip that goes straight on.
So Tracy, have you had this service done before?
Yes, and I love it. It is my favorite service to get.
All right, so Jess is going to work in sections on Tracy's skin. She's going to start on her cheek, and she's going to do about 4 to 6 passes. You can do up to 8. Pink skin is completely normal. A little pinprick bleeding is completely normal. You want the skin to get a little pink. All right, so here we go. So Jess is going to go, as I mentioned, in small sections. she's gonna be stamping the skin. This is a little bit different than skin pin or microneedling. This is gonna be called stamping rather. So Jess is going to be going in a crosshatch pattern, meaning kind of like this. Oh, I just bumped her a little bit. And she's gonna be just stamping the skin. So Tracy, raise your thumb up if you're feeling okay. Yeah, so it's really not that painful. I've had it done several times. Jess has had it done several times. Again, she said she is using the 0.25 tip. However, we do go all the way to 1.
Yeah, so that just depends on like what your skin needs, you know. If you just need light anti-aging, the 0.25 would be fine. So if you need like pigmentation or acne scars, we can go higher, and that would help those better.
Yes. So really, microchanneling is a collagen-inducing therapy that causes micro injuries to the skin, and really it just accelerates the wound healing process to produce collagen, elastin, and really help with those fine lines, wrinkles, bigger pores. It's great for sun damage, reducing any hyperpigmentation. We've seen some really great results with that. But overall, it is a great treatment for everyone, like I mentioned earlier. The treatment itself does last about 30 minutes, so you're really in and out within about an hour.
So yeah, it's a great treatment for people like, you know, that don't want to spend a lot of time in the spa and to have great results at the same time.
There's really not a lot of downtime associated with it. Yes, your skin will be pink. Yes, as I mentioned earlier, there could be a little bit of pinprick bleeding, but nothing too serious. You would be able to go back to work. We do provide a little bit of aftercare for you. Of course, you would want to stay out of the sun, just like with any other treatment.
Yeah, sunscreen every day.
Sunscreen every day. All my friends and family know I get on to everybody about their sunscreen. I wear it every day. I wear sunscreen, and then there's also sunscreen in my makeup, so definitely very important.
So I'm just going over some of the spots that don't look as pink to try to make the erythema more even throughout the skin.
Yes, and so erythema is redness. So we want a little bit of that redness to appear.
Right.
So she is rolling a delivery serum on her skin, and it contains growth factors.
Yes, stem cells.
Stem cells.
Growth
yes.
factors, yes. Let's turn the other way. And
All
it is
right.
from bone marrow too, so I think that's really awesome that it's bone marrow stem cells.
And the stem cells are just going to really enhance the service.
Right.
Really make those skin cells rejuvenate and regenerate and give her that beautiful glow. All right, so now we are doing the other side of Tracy's face. Typically we do start with just the cheeks first, and then we go into the chin area. And again, you can see this really is not a painful service. Tracy can almost take a nap. But you know, once you go up to the next level of needle or microfilament rather, it does get a little bit more painful for some, but as I mentioned, we do have the numbing cream, so that is always available. At Bare Necessities, we're always trying to provide just the best customer service and make sure that each treatment you're super comfortable. You know, we don't want to scare anybody and provide like a super painful treatment. So
Right.
if you have sensitive skin, or if you're a little apprehensive but you still want to look and feel great for that holiday season and prep your skin, we got you covered. So now she is doing the top portion of her cheek. You can still kind of see it's not super red, but it is getting a little pink. How many passes have you done on Tracy's skin?
Typically we just do 3. It just depends on how the skin reacts to it. But yeah, usually 3.
Okay, great. So again, there's really not like a set number that we do per skin or per client. We typically will do anywhere from 3, 4, 5, 6, you can go all the way up to 8. Really just depends on what you're trying to achieve. Tracy has pretty amazing skin, so we're not really having to do a whole lot of correcting here. But if you do have those acne scars or fine lines and wrinkles or even hyperpigmentation like I mentioned earlier, this is great for your skin.
Yeah, and it's a great preventative also for people in their getting into their late 20s and early 30s, you know, because it's really keeping up that collagen and elastin.
Yeah.
So you can do it on a regular, you can do it once a month to really maintain that preventative measure.
You can also pair this with other treatments. A really great pair with this service is our epidermal leveling, which is where we scrape all of the peach fuzz off of your face, and it's also a form of exfoliation. So when you do those two together, beautiful service. Your skin looks like glass.
Yes,
once
the
you're
glass
done.
skin.
You're red carpet ready.
Holiday ready.
But really, after one treatment of this, I really feel like my skin, I look like my whole face had Botox the next day. It's so smooth. Just the very next day, which is what I really like instant results.
I would love Botox, but I cannot handle needles, so
it's scary.
I'm very glad I found something that can give me the enhancement that I'm looking for to take that next step when you know my skin just needs it. It's hard sometimes to keep up with an everyday regime. We all get lazy. I love wearing makeup every day, and you know something like this just really helps keep the skin and the surface nice and smooth until I'm ready to cross that bridge for Botox, but I'm not quite there yet, unfortunately.
Well, you don't really need it.
Yeah, this has been a
gorgeous skin.
Yeah, this has been a great support of keeping the lines diminished.
Yes, yes. So I will say the most sensitive part of this treatment on the face is going to be the forehead. So even if you want to do numbing cream on part of the face, we can also provide that for you as well. But again, you'll see Tracy was able to just talk through that, so it's not that bad. For those of you who are tuning in, you do get 10% off of your microchanneling treatment if you mention that you watched us live. Tell your friends and family. We also have a great referral program. But is again great way to get ready for the holidays, and a great additional pairing with this treatment would be having the microchanneling done and then about 2 weeks later getting a nice Rhonda Allison peel or even an Eminence peel if you don't really want your skin to be super flaky. But really it would just enhance the treatment, make the results last longer, do any further correcting that you want done. Great for hyperpigmentation, acne scarring, like I mentioned earlier, fine lines and wrinkles.
Stretch marks,
yes. We do provide other areas of the skin, or the body rather. You can do your neck, you can do your hands, you can do your décolleté. As she mentioned, stretch marks, so if we have those on our tummies or our hips, we can certainly do that for you as well. Alright, so now she's doing the temples. And as you can see, Tracy is really not that red. She is a little pink, but easily could just go right back to the office or right back and pick up those kiddos from school. Now she's going to be doing the chin. I wouldn't really say the chin is that sensitive. It does feel a little funny because you can really like feel that vibration, but it's really not too bad.
Yeah, and as far as doing like acne scars or hyperpigmentation, you would definitely want to do a series of microchanneling for those corrections. Usually about 4 or 5, really. But you can do it, see how it goes after 3.
And we do have a discount if you do purchase a series. So 4 or more, you would get a $250 discount. So nice little savings right before the holidays, because I know, gosh, all those fun gifts that we have to get for family, kids, all of the above. Nice little savings, doesn't hurt anywhere we can. All right, so with this treatment, we will be doing the nose. You can also do the lips and underneath the eyes. Oh, as you can see, I'm not sure if you can see, but she did get a little bit more pink on the chin. Totally normal. A lot of our clients and even some of our ladies that work here, they want to see the pinprick bleeding.
Right.
They think it's really working harder when that happens. And truth be told, it's just, the erythema is great. You want to see that. You want to see the pinpricks. Okay, so she's doing the lip. Oh man. How's that feeling? Oh gosh, you can do it. So obviously for most people, the lip is the most sensitive area of the face. Even when we're doing waxing on the lip. But again, nothing you can't, not bad. Beauty is pain, right? That's what they say.
Exactly.
So I'm going to do the top of the lips, which is really great. It makes the lips really plump, so it kind of like just it.
Oh.
And this actually doesn't hurt. It looks painful, but it really doesn't. You really can't feel it.
I'm a huge baby. Everybody knows that. And it doesn't really hurt. Oddly enough, the lips don't hurt. Above the lip, yes. It's a little tender, but nothing you can't handle for a few seconds.
Yeah, I would say my most sensitive area is upper lip and underneath the eye. But we gotta take care of those wrinkles.
Yeah, you gotta get it done.
So she is doing the nose. You are able to do the nose. Believe it or not, the nose really doesn't hurt at all. You don't feel it. The vibration feels a little funny, but it's nothing too crazy. The reason why under the eyes and the lips, the top lip hurts so much is because the skin is typically a little bit more, or it's thinner rather. It's a little bit thinner. And then of course the upper lip does have a little bit more nerve endings. It's always a little bit more sensitive. But the nose, not sensitive at all. It's doing great, Tracy.
So tickly.
It is.
And it makes me want to sneeze.
Yes.
Yes.
I'm like, am I gonna sneeze?
All right. So what areas do we have left?
The eyes.
Okay, so she's gonna do the eyes next. As I mentioned, you don't necessarily have to do underneath the eyes, but obviously to have a full treatment, it is best to do the eyes. It's not going to be super painful, but it is going to be a little bit more of a tender area.
Yes. No lies.
Yes, yeah, no lies here, but obviously you can see Tracy has not been wincing or grimacing, so it's really not that bad.
Okay, so open your eyes and look up a little bit.
So she is going to hold the skin really taut. She is being very careful. And yeah, look, it's not that bad. So we do provide a nice aftercare mask for all of our clients. The aftercare with this treatment is very, very important. You want to make sure that you are providing your skin with a lot of hydration after the service. So the mask is going to be super cooling and feel so good.
So good.
Later on this evening when Tracy goes to
Yes.
get ready for bed.
It's a hyaluronic mask, so it really helps hydrate the skin. And there's a lot of product in that little Ziploc too, so you can actually keep the leftovers and use it for about 5 days afterwards. I don't know, maybe 3 days.
Yeah, typically I would say about 3 to 5 days, just depending on how much you're using on your
Yeah.
skin. But all that yummy gooey stuff at the bottom of the mask is so delicious for our skin. It just sucks it right up. As she mentioned, there's hyaluronic in it, which is super important for the skin healing and regeneration process after the microchanneling treatment. And again, as I mentioned earlier, you do want to use sunscreen. However, right after the treatment, we will not be putting sunscreen on. You do want to just go straight back into your car and then back into your house or your place of work. Because your channels are open, we're not going to put anything else on the skin for about 90 minutes. So after that, you're free to put on some sunscreen, anything that is not super active. So you wouldn't really want to put on your retinols or salicylic or glycolics, any of your acids, any of your super exfoliating topicals. You would also want to prohibit from exfoliating for at least 5 to 7 days. The first time I had this done, I exfoliated a little too soon and my face was on fire. And I didn't even use that heavy of an exfoliant. I used our Stone Crop Exfoliant in the shower. And I was thinking like, oh, not a big deal, it'll be fine. Nope, I was wrong. Definitely did it a little too soon. And the reason for that is because your skin is still healing. That's just really all there is to it. So you don't want to further irritate it. So
I know I said, there are times when it just gets tough to keep up with washing your face, putting your products on every day, but the next 5 to 6 days, would you say, Christina, are just very crucial. You want to make sure you stay on top of your aftercare because too, like Christina was saying, what this treatment is doing to your skin, those products, the ones that are within compliance, are going to penetrate your skin so much deeper and just really bring the results of your skin to the top, to the surface.
Yes.
So
Maximum
very
results.
important. Yes, absolutely.
yes, the aftercare is super important. You can wear makeup. I wouldn't wear makeup today, but you can absolutely wear it tomorrow. A little bit of skin flaking or sloughing is completely normal with this service. Some people experience that within about 2 to 3 days. Others, it takes a little bit longer. Just kind of depends on how fast your cell turnover is happening, and everybody's skin is different. Skincare is definitely not one size fits all, unfortunately. But what Jess is doing right now is she is just putting the rest of the delivery serum, which is the growth factors, on Tracy's skin, just to make sure that we provide maximum results, really. And
it's just sucking it right in too.
yes, yeah. As I mentioned, her channels are going to be open for about 90 minutes, so we would just want to make sure she is being sent home with the best results possible. Her skin is sucking it all up. I can see it going straight in there. It's really not even that shiny.
And if you notice, we didn't do any kind of massage or mask with this.
Right. So
Yeah.
it's definitely a quick treatment
Yes.
with big results.
Big.
Yes, yeah. This would not be a foo-foo treatment, clearly.
Right.
So there's no mask or massage associated with it. Your skin might feel a little warm or hot for the next 30 minutes to an hour. The first time I had it done, I would say my skin was warm for probably like 3 to 4 hours, but it wasn't like super uncomfortable or anything like that. It was a little bit tight. If you do experience some tightness, you can throw on some hyaluronic if you have it. Any kind of non-reactive toners are good, or toniques.
Just watch your ingredients.
Yeah,
you
just
don't
watch your
want any
ingredients.
active ingredients for the first 5 days, 7 days.
No active ingredients. So if you are a retinol lover, you're going to want to put that away in your cabinet so you're not
Yeah.
tempted to use it. Okay, so
Well done.
she is all done. Tracy's skin is definitely a little pink. Again, totally normal.
Feels great.
How you feeling? Yeah.
Yeah.
It looks plump.
Feels a little warm, but definitely no pain, no throbbing sensation, no lingering effects, or no stimulating vibrations. It just feels like you had a little active treatment done, but yeah, does not feel uncomfortable whatsoever.
Yeah.
Awesome.
And even the next day, you're not really that pink. It's
No. It
very
goes
little-
away very quickly.
hardly any downtime.
Yeah.
Really and truly.
Yeah.
Especially comparatively speaking to other collagen-inducing therapies that use.
I mean, I think that's definitely the plus compared to microneedling, is that there's no downtime, no cat scratches.
No, not at all. Well, awesome. So as I mentioned, if anybody was tuning in today and you mention that you watched the treatment, you will get a discount. So please feel free to give us a call. Our client coordinators are standing by. But thank you, ladies, so much for joining us today. Thank you, Jess. Thank you, Tracy, for being our model. If anybody has any questions, please feel free to reach out. We'd love to help answer any questions that you may have or give you any guidance that you may need. Stay tuned for next month. I believe we're going to be doing a epidermal leveling treatment. So for those of you who have never received one of those before or unsure what that is, as I mentioned very briefly earlier, it is a little, it's a skin scraping treatment that we use a scalpel with. So it removes dead skin and all that little furry peach fuzz. So that will be the first Wednesday in November. We're already in October, my goodness. But
It'll be here soon.
yes, it will. But thank you everyone for joining us today, and we hope you have a great Wednesday. Stay tuned until next month. Happy
Thank you.
October. Bye.
Thank you.
How do I turn?